Are you a member of the Hoag Medical Group or the UCI medical groups and also insured by Blueshield? If so, this video is for you. Hi, I'm Tommy at medicalinsurancetoday.com. Recently, the Hoag medical groups and UCI medical groups have been in negotiations specifically with the company Blueshield, and this pertains to the individual and family plan market, which includes Covered California. We do a lot of that. We help a lot of self-employed people here at Medical Insurance Today. We help a lot of folks that don't get insurance at work. And this video is specifically discussing the Blueshield HMO contract in the individual and family plan markets relative to Hoag and UCI. So Hoag is a top shelf, UCI as well. They're both top shelf hospitals in Orange County. They're both probably top 20 in the state of California. I think even higher ranked than that. And nationally they rank as well. They are as good of care as you can get in the hospital and medical group market. And definitely here in Orange County, everybody knows Hoag, UCI. The other would be Providence, but Providence is not pertaining to this video. Medical Insurance Today is based out of Costa Mesa in Orange County, California. Costa Mesa is adjacent to Newport Beach, which is where the original Hoag hospital is at. Probably close to 35 or 40% of our clients are on this Blueshield HMO product, and they are seeking care through the Hoag Medical Group and through that contract and agreement between Hoag and Blueshield. So this is affecting us in a large way. It is affecting, from what I've been told, near to tens of thousands of consumers in Orange County. And I mean, it's a lot of people that are being affected by this. What we're being told is that as of July 1st, if you are on that Blueshield plan and you're a member of Hoag or UCI, you will no longer be able to access your doctors or those medical groups if they cannot come to an agreement about their contracts. Really unfortunate situation. This one is hitting me personally. My family is insured on this Blueshield HMO plan, and both my children were born at Hoag. My sister was born at Hoag. Everybody in the Western Orange County region knows about the Hoag Hospital. That is affecting, and the true point of this video is to address Hoag specifically to my consumers. UCI is equally as important because of our clients that are in Santa Ana and Orange and in Central Orange County. UCI is one of the top hospitals in the state, and a lot of people are insured by Blueshield and accessing UCI. So it's a real unfortunate situation. If Blueshield and Hoag UCI cannot come to mutual agreement, what's going to happen is consumers are either going to faced with a couple tough decisions. First one being to continue access to Hoag UCI, you can buy up to the Blueshield PPO, which would allow you to continue access to the group and all of your doctors therein. The PPOs, though, have gotten crazy expensive. To speak very plainly, I mean, you're talking about hundreds and hundreds of dollars a month. It's close to $9,000 a year for my family to buy up to the PPO from the HMO market. Give you some kind of indication. I'm a family of four. I have two children, me and my wife, and it would cost almost $9,000 to buy up to the PPO, additionally to the HMO cost, which is already expensive. So consumers are going to have that option to buy up to the PPO. That is one option of consideration. Of the 20 people I've talked to about this in the last couple days, I'd say 1 out of 10 are saying yes, they can afford the PPO with the increase in cost, or they're just willing to bite the bullet because they need to continue care. For folks with health issues, this is a real unfortunate circumstance, and you know, it's just it's a bad situation for a lot of people. And even if you don't have health issues, it's uncomfortable having to switch your doctors. But imagine you have cancer, or you have a chronic or acute disease that you're treating and have, you know, specialists, and you're having to change either plans to a more expensive plan, or the second option, if you can't buy up to the PPO, because many of the folks I've talked to plainly just cannot afford going up to that PPO plan, is going to be changing to another group of doctors. That's where we can come in and help you. In both circumstances, we can help our consumers move over to the PPO. Gladly to do that. Our goal is always to find the most affordable plans that are out there for our customers, make sure that you're staying in something that's manageable, that you can afford to keep and remain insured. If you cannot afford buying up to the PPO, the alternative is to change to a new medical group. And what we're seeing, if you're staying with Blueshield as a customer, the primary groups that we're showing are going to be Memorial Care and Optum medical groups. Now, Memorial Care is a really large group. not as large as Optum, but they have a real prominent footprint in the Northwest Orange County marketplace, and they go up into LA. Memorial Care is a prominent, well-respected, and very good group, and we're happy to help guide any customers that need guidance on new doctors to what your options are therein. Optum is like one of the largest groups in all of Southern California. They are huge, very well respected and looked upon. They're not Hoag though. So, this is the issue that we're running into with Memorial Care and Optum, is people want their Hoag. And rightly so. This is an unfortunate circumstance to be happening midstream, we say, of the season or during the year. One would think they would, Blueshield and these two medical groups would try to negotiate this around open enrollment so people could be aware and make the change at the beginning part of the year so you could change your insurance at the end of the year as usual, when that October, November open enrollment comes around. But it's happening mid-season, and it's apparently, as of right now, the letters I'm reading, as of July 1st, if you're on that HMO with Blueshield, you're going to lose access to Hoag and UCI. So, long and skinny of this video is to be a resource to all consumers out there and help be an information source and hopefully a guiding light to our customers as to what to do. I know from talking to customers over these last 17 years that most people don't understand how their insurance works. When they get news like this, it throws many people. I've talked to a couple people in the last couple days that are in straight panic about losing their doctors potentially. And that is a real circumstance. It's a real thing. But there is a light at the end of the tunnel. I'm here to tell you that there is a solution, and we are very solution-oriented here at Medical Insurance Today to help you find the right answer, help you find new doctors if you need them, or help you move to the PPO if that's the case. I will be moving to a new medical group. I'm going to probably be going to Memorial Care, and I've done some research. There are lists, and they're a very large group, so there are long lists of doctors to choose from that if you are stuck in this predicament, that we can help you find and help you navigate and help you find ratings and find someone close to your home, obviously, that you can move over to if need be. So we would love to help you. If you are still watching this video and would like some help, please reach out to us. All of our contact information is in the caption below. Medical Insurance Today in Costa Mesa, California. And we would love to help you through this transition. It's a big issue for us and for all of our customers locally that are accessing Hoag, so we would like to help you find a solution around it. Please be in touch, and we look forward to serving you.